Hello, I'm Dr. Marla Shapiro, and I'm on the board of the International Menopause Society. And today I'm joined by Dr. Sue Davis, a past president of the International Menopause Society. Welcome, Sue, and tell our viewers who are watching who you are and what you do.
Hi Marla. I'm an endocrinologist in Melbourne, Australia, and over the last 30 years, my career has involved treating women with menopausal symptoms, and also I've done a great deal of research in the field of testosterone for women.
So that's what we're going to talk about today because many women wonder about the use of testosterone and if that's something that they can use.
So we often talk about testosterone because it's an important hormone produced by both the ovaries and the adrenal glands in women, and levels do decline with age. Now, we have shown that testosterone can be very beneficial for postmenopausal women who experience loss of interest in sex that is bothering them personally, and that in that setting, it can actually improve sexual interest and responsiveness and therefore sexual pleasure in postmenopausal women.
So let's talk about these women who are watching and listening who are in the menopausal period. Some of them may be on estrogen for hot flashes and still have an issue. Some may not need the use of estrogen. How would testosterone fit into this patient setting?
So, testosterone is usually prescribed for postmenopausal women, as I said, with loss of interest in sex, who have been spoken to their doctor, and it's quite clear that there isn't another cause. Like it's not that you're on an antidepressant or having a relationship issue, etc., or other health issues or medications. And in that setting, it can be used either with estrogen or estrogen and progestin, which many women take, or it can be used alone without estrogen or progestin in postmenopausal women.
So, if I'm a patient and I'm a woman who's experiencing this, should I go and have something compounded in the pharmacy? Because many pharmacies will make a prescription that's supposedly just for me because of my particular testosterone needs.
So, the problem we encounter with compounded hormones is that these have not been tested to ensure exactly what dose needs to be given to be absorbed through the skin to create a given blood level. So the absorption is not established. The medical term we use for this is pharmacokinetics, which is a complicated term, but it really means that if you go and you get, for example, estrogen that's been made by a pharmaceutical company, we know what doses will give what effects in women. With the compounded hormones, whether it be estrogen, testosterone, progesterone, we can't be sure that it's absorbed, let alone what blood levels are achieved. So, when it comes to testosterone, which is not approved for women as a specific product in most countries, we would much prefer women to speak to their doctor and be prescribed a male formulation, but just to use about a tenth of the dose that a man would normally use for testosterone replacement.
So, if I'm also experiencing fatigue or my mood has changed, will testosterone help me with those symptoms?
Well, it's often suggested that testosterone can be used for low mood, fatigue, depression, foggy brain. But in fact, there is no evidence to support a benefit of testosterone for these symptoms. And these are likely to be due to other causes, particularly sleep deprivation. And even women on hormone therapy often experience ongoing disturbed or unrefreshing sleep. So I wouldn't want to mislead women into their thinking that testosterone is the sort of tonic for these symptoms.
And what type of side effects might I expect being on this medication?
So, if I was to prescribe testosterone for you or any other woman, um, if you it's self-administered because it's usually administered as a patch or usually as a gel or a cream through the skin. If you apply too much, you will get the side effects that you can see. So the first thing might be oily skin, pimples, and noticing some subtle increases in hair growth. That would indicate you are using too much for you. And although we can monitor the testosterone levels with a blood test, the most important way of monitoring adverse effects is actually cosmetic appearances. So anything that looks like virilization or masculinization is too much testosterone.
So it's a case of some is good, but more may not be better. So because we're
Yes,
applying a cream or a gel, we need to be cautious and follow the advice that we're being given.
indeed. And in fact, the studies of testosterone in women have shown that there is a Goldilocks effect, that a little doesn't work, but equally a lot doesn't work in women. And there is a female dose that is just the right dose, like Goldilocks story
Right.
for women. It really is a Goldilocks effect.
And one last question before I let you go. If I'm doing well and I'm feeling better, must I stop this at some point or can I continue it?
Testosterone can be used for women as long as they feel that they are continuing to receive the benefit. So if you were using it and you felt that it was good for you, you had no side effects, you had regular monitoring by your doctor, both with blood tests and clinically, then you can use it as long as you feel you are benefiting from it. We do know that not every woman will benefit, and it is a trial of therapy. So if you were to find after 6 months you felt absolutely no difference with using it, it would be recommended that you cease at that point.
Well, thank you so much for talking to us about this topic. It's a great topic of concern and interest for women.
Thank you, Marla.